Welcome. Today we're diving into specific learning disorders, a group of neurodevelopmental conditions that can significantly impact a person's ability to learn and process information. These disorders aren't about a lack of intelligence. Rather, they reflect differences in how the brain handles certain skills. We'll explore what causes these disorders, how they affect the brain, the signs to look for, and what can be done to help individuals thrive. The exact cause of specific learning disorders remains complex and multifaceted. Research suggests a strong genetic component, meaning these disorders often run in families. Brain imaging studies have revealed structural and functional differences in the brains of individuals with learning disorders, particularly in areas related to language processing, reading, and math. Environmental factors, such as prenatal exposure to toxins or complications during birth, can also play a role. It's important to remember that it's usually a combination of these factors, rather than a single cause, that contributes to the development of a specific learning disorder. At the neurological level, specific learning disorders involve disruptions in the brain's neural pathways responsible for processing information related to reading, writing, and mathematics. For example, in dyslexia, there may be reduced activity in the left hemisphere regions involved in phonological processing, the ability to break down words into their individual sounds. Similarly, dyscalculia can be associated with differences in brain areas involved in number sense and mathematical reasoning. These neurological differences don't indicate damage. Instead, they represent variations in how the brain is wired, making certain cognitive tasks more challenging. Specific learning disorders are quite common, affecting an estimated 5 to 15% of school-aged children. They occur across all socioeconomic backgrounds, races, and ethnicities. While rates may vary slightly depending on diagnostic criteria and assessment methods, the prevalence highlights the importance of early identification and intervention. Boys are diagnosed more frequently than girls, but this may be due to differences in presentation and referral patterns rather than a true difference in prevalence. The signs and symptoms of specific learning disorders vary depending on the specific type of disorder and the age of the individual. Common signs include difficulty with reading fluency and comprehension, struggling with spelling and writing, difficulty with math facts and problem solving, trouble organizing thoughts and materials, and challenges with following instructions. In younger children, early warning signs might include delayed language development, difficulty recognizing letters and numbers, or struggling with rhyming. It's crucial to remember that these are just some possible indicators, and a professional assessment is needed for accurate diagnosis. Diagnosis of a specific learning disorder involves a comprehensive assessment by a qualified professional, such as a psychologist, educational diagnostician, or neuropsychologist. This assessment typically includes a review of the individual's developmental history, academic performance, and cognitive abilities. Standardized tests are used to evaluate reading, writing, math, and other relevant skills. It's important to rule out other potential causes for learning difficulties, such as vision or hearing problems, intellectual disability, or emotional disorders. A key diagnostic criterion is a significant discrepancy between the individual's expected academic performance and their actual achievement. Despite adequate educational opportunities, specific learning disorders are classified based on the specific academic skill that is affected. The most common types include dyslexia, characterized by difficulties with reading, dysgraphia, characterized by difficulties with writing, and dyscalculia, characterized by difficulties with mathematics. It's important to note that an individual can have more than one type of learning disorder, and the specific manifestations of each disorder can vary from person to person. There is no cure for specific learning disorders, but effective interventions can significantly improve academic performance and overall well-being. The most common treatment approach involves specialized instruction tailored to the individual's specific needs and learning style. This may include individualized tutoring, multisensory teaching methods, and assistive technology. Early intervention is key to maximizing the effectiveness of these interventions. Additionally, accommodations in the classroom, such as extended time on tests or the use of assistive devices, can help students succeed. Support from parents, educators, and therapists is crucial for fostering a positive learning environment and promoting self-esteem. While there's no guaranteed way to prevent specific learning disorders, certain strategies can help reduce the risk or mitigate their impact. Promoting early language development through reading aloud and engaging in conversations with young children is essential. Providing a stimulating and supportive learning environment from an early age can also be beneficial. Early identification and intervention are key to preventing academic frustration and promoting positive learning outcomes. With appropriate support and intervention, individuals with specific learning disorders can lead fulfilling and successful lives. While they may continue to face challenges in specific academic areas, they can develop strategies to compensate for their difficulties and achieve their full potential. Recent research is focusing on identifying biomarkers for learning disorders through brain imaging and genetic studies. Advances in assistive technology, such as text-to-speech software and digital writing tools, are also providing new opportunities for individuals with learning disorders to access information and express themselves effectively. Ongoing research continues to refine our understanding of these disorders and develop more effective interventions, paving the way for a brighter future for individuals with specific learning disorders.